Hello, everyone. Welcome to today's Pet Podcast. I'm your host, Dr. Roberta Westbrook, and you're here with us at the Campus for All Animals, the Houston SPCA. Thank you, as every week, for joining us. And I would love to start by introducing you guys to our Pet of the Week this week. Our Pet of the Week is a beautiful, beautiful, about 2 years old. Her name is Alondra. Alondra is a beautiful, about 2-year-old female. She's spayed, current on all her vaccines, and she is looking for a home. She's looking for a new family. She's really sweet. She would make a wonderful family pet. She's been with us for almost 80 days, and we don't know why. She's so sweet and loving. You know, she just is looking for the right family to come bring her into their home. So if you're interested in meeting with Alondra or any of our other pets that are available for adoption, please don't hesitate to come on down to our adoption center any day of the week from 11 a.m. to 6 p.m. There's no appointment necessary, and our adoption team would be happy to help you find the pet that fits your family the best. So I want to talk to you guys today about a health condition that is pretty common in animals, and oftentimes people don't know that this is possible, and that health condition is called kidney failure. So as pets age, they can develop kidney failure very much in the same way that human beings can develop kidney failure. And so today we're going to talk about the different types of kidney failure, some of the causes, how you might know that your pet is showing signs that they might have an issue with their kidneys, and what your veterinarian may have you do about it, how we can manage it. So we're going to talk about kidney failure today. If you have a pet with kidney failure and you have questions, or maybe you are wondering about this for your own knowledge, please don't hesitate to put some questions in the chat, and hopefully I can help you today. So in general, we'll start with kidney disease. In general, there are 2 types of kidney disease. We usually divide it in terms of whether it's acute, so we have acute kidney disease or acute kidney failure, and we have chronic kidney disease or kidney failure. Acute means that it has happened suddenly. It's usually a quick onset, and depending on the cause of it, oftentimes the pet can go back to live a normal, happy life because this has been an acute incident, as opposed to chronic kidney failure or chronic kidney disease, where it happens over an extended period of time and it continues to get worse and oftentimes is not reversible. So we do tend to divide kidney disease in terms of acute or chronic. Does anyone have any questions about kidney disease?
What can lead to acute disease in kidneys?
Right, so common causes of acute kidney disease tend to be things like toxicities. So maybe a pet may have gotten into some medication or eaten a plant or some type of food or gotten into a chemical. Usually toxins, ingesting things that are toxic to the body, can lead to acute kidney failure. Sometimes it's the medication that was taken, and that can be acute kidney failure. Another thing that can cause kind of acute kidney failure is severe dehydration for some other reason. So it's important for the kidneys to function well, to have good blood supply, good blood flow, and anything that decreases blood flow to the kidneys can cause the kidneys to shut down temporarily or acutely. But oftentimes, we're able to get the kidneys back to normal function. So those are some common causes of acute kidney failure.
And then you said for the chronic ones, usually with age, when does chronic kidney disease usually occur?
So it takes some time generally. So usually your veterinarian will talk to you about the history of your pet. They'll ask you questions about when you first started seeing some symptoms, how long this has been going on. They'll take into account your pet's current health. And if your pet has been visiting the veterinarian on an annual basis, they may have evidence in previous blood work screenings about the health of your pet's kidneys. And so if we see that the kidneys have been declining over a period of time, usually we may say, you know, your pet has chronic kidney failure, meaning it's been going on slowly for usually several years and is likely going to continue. So if your veterinarian is talking to you about chronic kidney failure in your pet, the signs that you might notice in both acute and chronic kidney failure are usually you will notice changes in your pet's urination habits. So sometimes with kidney failure, you might actually notice that your pet is going to the bathroom more, urinating more. And oftentimes the urine will be more dilute. So instead of having a yellow color to the urine, oftentimes it looks very clear. And the reason for that is the kidneys are supposed to concentrate the urine. So as blood goes to the kidneys say, I need to preserve water for the body. And whatever water I don't need, I'm going to release into urine. Well, when the kidneys are not functioning, oftentimes the kidneys don't do a good job at conserving water, and they let all the water go through the kidneys, and that is what makes the urine look very dilute. And so sometimes having very dilute urine in larger amounts can be one of the signs of kidney failure. Dogs and cats who are having kidney failure oftentimes don't feel well either. They may have vomiting or diarrhea, inappetence, they don't want to eat, and they're lethargic. So there could be a couple of things going on. And really severe kidney disease, we can also see signs of kidney disease through having bad breath, because the kidneys will give off a bad odor, and sometimes it will even cause ulcers in the oral cavity, particularly in cats. They can get ulcers in the mouth from all the toxins that the kidneys are not handling appropriately.
And that's good you mentioned like it causes more like urination, because our common thought is, oh, if the kidneys aren't working, then they're not urinating at all.
That's a great question. And there are different stages of kidney failure. So you can actually have different amounts of urine production throughout the stages of kidney failure. So sometimes it causes more frequent urination that's very dilute. And then in some stages of kidney failure, it is true that it's possible that there is no urine production at all. And usually that's when the kidneys have completely shut down as well. So it depends on the stage of kidney failure and the cause and where we are in terms of how much urine production there may or may not be. The veterinarian can help to determine that, and they can even do tests to determine the concentration of the urine to see how well the kidneys are functioning and help to mitigate the worsening of the condition.
And what are those like things that the vet looks for? Is it blood tests or urine tests? What indicates kidney disease?
Great question. So what tests are we looking at to indicate kidney disease? And it's both. So generally we will start with blood tests and urine tests. And so there are blood tests that we can do that when we run those blood tests, it can tell us about the kidney enzymes. And kidney enzymes are a group of parameters that can tell us about the injury that's going on with the kidneys and how well the kidneys are able to filter out some of the toxins in the body. So we call those kidney enzymes, and your veterinarian can take a look at those. They're enzymes like BUN, blood urea nitrogen, and creatinine, phosphorus. All of these things can help us look at kidney function and help to determine how well your pet's kidneys are functioning. The other thing is looking at the urine. Again, the kidneys help to produce that urine. We always like to take a look at how concentrated the urine is. It is the kidney's job to concentrate the urine. So again, when we see a combination of maybe elevated kidney enzymes along with not very concentrated urine or very dilute urine, we're wondering whether there's some kidney disease going on and what the cause of it is, and that's what we'll look for. We also look for evidence of infection. Sometimes infection in the kidneys can also cause acute kidney failure. And so we'll be looking at blood and urine to help determine whether or not your pet has kidney failure.
And if they are in kidney failure, what is the treatment plan for a pet?
Yes, great question. And so the treatment plan will depend on the cause. So another way that we like to characterize kidney failure is based on the cause. So I mentioned there's a time component, acute versus chronic, but there's also a cause component, and there's 3 of those. So we talk about kidney disease being caused by pre-renal causes, things that occur before the blood gets to the kidneys. Then we have renal causes, things that are going on with the kidney itself. The kidney itself is not functioning. And then we have what we call post-renal causes. Post-renal causes are things that are going on with the body as blood flows out of the kidney and urine is flowing out of the kidney. And so we have three types of causes there. So as I mentioned, if it's a pre-renal cause. When we say pre-renal, we mean things that are going on in the body before blood ever gets to the kidneys. Dehydration is one of those. It's important for your pets to stay very, very hydrated, because keeping your pets hydrated actually helps to keep the kidneys functioning well. So severe dehydration is actually a cause of kidney failure, of what we call pre-renal kidney failure. Then there are some kidney diseases themselves, some actual problems with the kidney. Sometimes it can be, an abnormal development to the kidney, or some type of bacteria that's infecting the kidney that can cause the kidneys not to function. So we call that renal kidney failure. And then we have post-renal failure, which is usually a type of obstruction. So this is where maybe there is a pet that is unable to release the urine. And so even though the kidneys have produced the urine normally, the pet is not able to urinate that urine out, usually caused by an obstruction like bladder stones or a blocked urethra. And that can be not only painful, but life-threatening. And so it depends on the cause, how we treat it. The mainstays of treatment are fluid therapy. So the veterinarian may recommend that your pet be on regular fluid therapy, which can typically be intravenous fluid therapy, where they go to the hospital and they get intravenous fluids delivered that helps to flush the kidneys out. Sometimes it can be given under the skin. So sometimes the veterinarian can recommend that your pet have subcutaneous fluids given on a regular basis, usually several times a week. It also may include a diet change. So when your pet, and if your pet gets diagnosed with kidney disease, one of the important things that your veterinarian is going to recommend is changing the diet. The reason is we want to be easy on the kidneys. We really want to make sure that we're easy on them. So that could mean giving a diet that has less protein. Proteins are molecules that are very big, and they're large, and they can be heavy on the kidneys. They can kind of be hard on the kidneys. So usually we give low protein diets when a pet has kidney disease. So there's lots. This one is KD, stands for kidney disease, made by Hill's Pet Nutrition, or your veterinarian may recommend a different low protein diet. So we have those, and then other treatments may be antibiotics or other types of therapy depending on the cause. Like I mentioned, sometimes it's a toxin, and there may be specific treatments depending on the toxin that may have caused that kidney failure.
And then do dogs ever get dialysis like humans?
Great question. That's almost what I just mentioned. So dialysis is essentially flushing all of the toxic chemicals out of the body using a machine that filters the blood. So again, the kidneys help to pull some of the toxic molecules out of the blood and put them into the urine so that they can leave the body. Well, when the kidneys are not functioning in humans, we have dialysis machines that can help filter those toxins out of the blood, and it usually takes several hours. We don't do that routinely in pets. What we do, though, is still use the same idea through fluid therapy, through intravenous fluid therapy or subcutaneous fluid therapy. What we're doing is we're trying to flush those toxins out of the body by introducing more fluid and helping the kidneys out by pushing those toxins out through the kidneys with fluid therapy. And so it's similar, but not quite as intense as dialysis in humans.
And can kidney failure be reversible?
In some cases it can be. So in some cases, especially acute kidney failure, where there has been an insult to the kidneys or damage to the kidneys that has caused maybe, the kidney enzymes to be elevated, with proper treatment and quick treatment, sometimes pets can go back to having what's considered normal kidney function. And so it's just really going to depend on the cause and how quickly your veterinarian was able to get to your pet to institute some of those therapies.
And if they're in kidney failure, how long can my dog expect to live?
That's a good question. And unfortunately, I don't have an exact answer for how long pets live after they're diagnosed with kidney failure. Again, it oftentimes will depend on the cause, and it may depend on how severe it is at the time of diagnosis, and other factors, other health conditions that may be contributing to the kidney failure. Pets can live for many years. I personally had a cat with kidney failure. My cat passed away at the age of 19. We diagnosed her with kidney failure probably when she was about 16 or 17. And so we think she probably lived for 3 or 4 years after we diagnosed her with kidney failure before she passed away from what we believe is her kidney failure. And so pets can lead long, happy lives, and they can live for several years after diagnosis, but it did require, like we did, to give her fluids regularly, to change her diet to something that was low protein, and to make sure that she was staying healthy and that we were not adding anything to her diet or any medications that were also going to be hard on the kidneys. But pets can live several years after the diagnosis, but again, depending on the cause. Chronic kidney failure in general tends to be slow moving, and so as long as you can do what your veterinarian says to maintain it, pets can usually live for several years. Acute kidney failure, particularly if it's caused by a toxin, something that pet has ingested, there are certainly times where pets do not recover from that acute injury because it's so quick and it's so severe and it comes on before your veterinarian is able to give the proper treatment to get those kidneys back to a healthy condition.
And more for the chronic, is there any way that we can do as our pet gets older that we can help prevent it before they get to those stages?
Yes, seeing your veterinarian and getting regular blood work is probably going to be one of the best things you can do to maybe slow down or prevent kidney failure. And what you're going to be doing is helping to catch it early. So helping to recognize when there may be some abnormal blood work or abnormal urinalysis, and making sure that you can do things to change the diet sooner rather than later. So changing the diet, making sure your pets are not eating really high protein diets that can help with the kidneys, and then just keeping your pet healthy. So preventative maintenance, just by going to your veterinarian and getting regular blood work, is probably one of the best things that you can do to stay on top of it. Well, we thank you so much for joining us again. I know it's a lot to talk about with kidney failure, but again, if you think that your pet is showing signs of illness, again, not eating, lethargic, vomiting, maybe there's a foul odor to the mouth, maybe you're noticing changes in urination habits, maybe your pet is starting to have accidents where they didn't before, or you're noticing that they're straining to urinate. Maybe you have a cat that is straining to urinate. These things can be associated with the urinary system and the kidneys. See your family veterinarian sooner rather than later, as this can be life-threatening, and we want to make sure that your pets live long, happy lives with you. So thank you for joining us again, and we will see you next week on the Pet Podcast. We hope that if you have a pet that's due for any preventive care, vaccinations or microchipping, or you need some advice for your pet, please consider coming to our pet wellness clinic here on our campus. We will help make sure your pet stays current on heartworm prevention, flea prevention, tick prevention, deworming, whatever you need for the preventive health care of your pet, we can help you with. We're open every week, Thursday through Sunday, from 10 a.m. to 5:30 p.m. So come on down and visit us. We'd be happy to help you. And we'll see you next week on the Pet Podcast.